Understanding Procedural Coding, a Work Text. Chapter 17, the Nervous System. Please turn your coding manual over to the Nervous System section of your coding manual so you can follow along with the presentation. This will be behind our endocrine system, and the endocrine system is behind our genital system, female and male. So if you can kind of find that, I have it on page 340. That seems to me it's kind of helpful if you can follow along as I cover chapter 17, nervous system. Okay, so when we're looking at this subsection of our coding manual, we see that it's broken down in a couple of subsections here. You have your skull, meninges, and brain. You have your spine and spinal cord, and then it has a small section on your extracranial nerves, peripheral nerves, and autonomic nervous system. You need to make sure you kind of briefly brush up on your nervous system sections. And you got a couple of good figures there in your chapter 17 to kind of help you out with that in terms of where everything's located, what's included, and so forth. Figure 17.4, it just goes through, shows you the different sections of your brain. It shows you the brain stem, your spinal cord, your different nerves. Then it looks at your peripheral nervous system and your central nervous system. You got a bunch of figures, cranial nerves that you can take a look at. So when you have a minute, you can look at that. So let's kind of focus on the different procedures, and we're going to start with the section on your skull, meninges, and brain. Now, I talked about those three subsections that the nervous system is broken into in the coding manual, and you can notate those because they're in red. The font is in red, so you can see where those start at. All right, again, skull, meninges, and brain. Let's look at those procedures there. It starts with your injection, drainage, and aspiration. You see in that section for your skull, meninges, and brain, you got a subdural tap. You got punctures here. Punctures, subdural tap, all on your injections and drainage. You have insertions. Also on the well, I moved into this because the injection, drainage, and aspiration has the subdural tap and the punctures, and then I was passing over. There's a section called twist, drill, burr holes, or trephine, and that's where you start getting into. They have a couple of codes for insertion of pumps and things like that. But when we're looking at the twist, drill, burr hole thing in particular, they actually use this to access that cranial or that brain area. They actually drill those holes into the skull so that they can access the inside and do whatever type procedures they're looking at doing. You also notice them using the terminology here, trephine. And trephine is actually a surgical instrument, and your book points that out, that helps to cut a cylindrical shape into the skull. And figure 17.8 is showing some examples of burr hole procedures or burr holes. So you can take a look at that. So that section covers those burr hole procedures. Now after that, you have your craniectomy and craniotomy. Okay, and with your craniectomy and craniotomy procedures, your codes here, a couple of them you see, they're broken down or differentiated by whether it's extradural or subdural or intracerebral. You see those there. You see an add-on code. But basically, that whole section, craniectomy, craniotomy, your book also tells you about code C61304 and 61305, and how they can't be reported separately if we have another more extensive procedure being performed. All right. So in this section, they're all broken down basically according to the reason for doing the craniectomy or the craniotomy. From there, you have a section, if you flip over in your coding manual, you see surgery of the skull base. And with this type of procedure, you have it categorized according to, and if you're looking in your coding manual, it says the approach procedure necessary to obtain exposure of the lesion, the definitive procedure necessary to biopsy, excise, or otherwise treat the lesion, and then repair and reconstruction of the defect present following the definitive procedure. So those are the three categories under here. You also find out here from your textbook that this type of procedure typically involves more than one surgeon. And basically, if that physician is doing multiple components, then they're going to need to report Modifier 51 with their code. If you have different surgeons performing different components, then each surgeon is going to report the code for the part that they completed. All right, and if you look there, if you flip through your coding manual, you'll see where they have a section just for approach procedures, and they have a section on definitive procedures. And then right at the bottom of that surgical skull base, you got repair and reconstruction. Two codes that fall under that. Now, after you leave the surgery in the skull base, you see a section here on endovascular therapy. And in this section, it involves the head and the neck, the vascular system in the head and the neck, and it tells you that these procedures are used for controlling bleeding, destroying tumors, and so forth. Also, they're differentiated according to the type of endovascular therapy that's being completed, and then also the location of the number of vessels on which they are completing that procedure. Your next section here is for surgery for aneurysm, arteriovenous malformation, or vascular disease. In this section, if you just kind of briefly go down, you see malformation codes, intracranial aneurysm codes, anastomosis procedure under this section. Your book also tells you how you would go about looking these up in your CPT manual. You can look up aneurysm repair, arteriovenous malformation, vascular malformation to locate these specific codes. Your book also talks about, in terms of that intracranial arteriovenous malformation, and how that you have to look at the location of that tumor and the complexity of assessing that tumor, basically whether it's simple or complex when you're coding in that. And you can see that, for example, in your code 61684, 61686. Those are examples where the code is differentiated based on whether it's a simple or complex procedure. Following that subsection, or that small section there, we have stereotaxis, and your book takes time out to explain to you about a stereotactic procedure, how they use a CT scan or MRI scan to try to figure out where they need to perform the procedure. Then they use burr holes for access in order to insert needles or electrodes, catheters, or probes. And so basically, when you're coding in this section, you need to know the procedure performed and why they're performing that procedure. All right. If you flip over in your coding manual, following your stereotaxis, you have stereotactic radiosurgery section, and basically this is where they're going to use radiation to eradicate different areas in the head, and it allows them not to have to cut or incise into that area. These codes are going to be reported. If you notice in that thing, it says radiation oncology and all those. These are going to be reported by your neurosurgeon, and that radiation type situation may call for you to use codes in your 7000 series, and that's involving your radiology type codes. The next section under your nervous system is your neurostimulators. Okay, and with your neurostimulators, you can have simple and complex neurostimulators. Your codes are differentiated by the type of approach, how they get in, and the type of neurostimulator that they're going to place. All right, and you'll look here on your slide. It tells you they can be twist drill, burr hole, craniotomy, craniectomy, several different ways to place that neurostimulator. You also have a nice example there in your coding manual showing the placement of a cranial neurostimulator right above your code 61870. And so if you're looking at the codes themselves, you see they have codes for insertion, they have codes for replacement, or revision and removal for your neurostimulators. Following that section, you have a section on repairs. Right? You got, and under there you have craniotomy for repair. You have repair of an encephalocele. You got cranioplasty, removal of bone flaps. You got a couple of those type of codes falling under your repair. Okay, and again, we're still in your skull and meninges and brain. After your repair, you got a code section on neuroendoscopy. And just like we do any other like scopy type procedures, your diagnostic will be included in a surgical type endoscopy, a neuroendoscopy that occurred. And your codes here are differentiated by the reason for your neuroendoscopy. Now, following your neuroendoscopy, you have a section on cerebrospinal fluid shunt, CSF. They use those shunts, they drain the fluid away from the brain. And if you look there, they have several types of codes: creation, replacement, irrigation, and removal of CSF shunts. You also have a nice picture example right above your code 62225 of a cerebrospinal fluid shunt. That closes out our first section of codes under your nervous system for your skull, meninges, and brain. And then that leads us right into our second subsection on the spine and the spinal cord. And you're going to notice that a lot of these codes are going to be kind of the same type of procedure that we had completed on the brain, but they also completed on the spinal cord. So we begin with your injection, drainage, and aspiration type procedures under your spine and your spinal cord. You got injections for adhesions in this section. You got percutaneous aspirations. Also following here, you got biopsies of the spinal cord, spinal punctures in this section. And I think we already talked about injection procedures as well. Now, after that section, then there is a 3 codes here for catheter implantation, and you'll see here that you have an implantation code, and it's with or without laminectomy, and then you also have a removal of the implant, 62355, under your catheter implantation. Under that, you have for reservoir and pump implantation. So your first code implantation or replacement, that's your 62360. You also have removal of the pump. You got a couple of different things looking at the pump. Now, if you look, your book kind of talks to you about the catheter and the pump, and that they use this for to allow medication installation into the spinal area. And so we have your implants and your removals, and that's why they're putting them in, taking them out, those types of things, removing, implanting the pumps and the catheters. You have a picture there right below code 62362 of a intrathecal or epidural drug infusion pump implementation, showing you an example of one there. After that, you have several pages looking at exploration and decompression, right? And basically with those codes, it starts right here at your code 63001, and you see your laminectomies, laminotomies, and those types of situations there. And then you flip over, you got another section, and if you know, there's like 3, 4, 5, about 6 or so saying something about exploration or decompression, but there are different approaches. All right, so they're reported by the type of approach and what segment of the spinal area that procedure is being performed. So you see the posterior extradural laminotomy or laminectomy. The other one says transpedicular or costovertebral approach, interior or anterolateral approach. You got lateral extracavitary approach, and so forth. So there's like multiple approaches for your exploration decompression. Okay. And all of those are dealing with your laminectomies and your laminotomies. You can flip through those. Now, following that, you're going to see some familiar terms here. Stereotaxis, your stereotactic radiosurgery. Again, that's where it comes into play, where those procedures done on the brain also being done on the spine and spinal cord. So it's pretty much, and as your slide says, they're parallel procedures completed on the brain. Same deal here. Your neurostimulators, same thing. Same thing that we discussed about the brain. This goes for your spine and your spinal cord. There's also the shunt, the CSF shunt. Again, same thing, parallel procedure. The final section under your nervous system is going to be for your extracranial nerves, peripheral nerves, and autonomic, I can't even say it right, nervous system. And if you look closely at this section, it begins with your introduction injection or nerve block. And then in that section, if you look, it's divided by your somatic nerves, your paravertebral spinal nerves and branches, and your autonomic nerves. All right, so it's divided into 3 sections for your nerve block. Injection of a anesthetic agent or nerve block. Okay. Then you have your neurostimulators on your peripheral nerves. It tells you peripheral nerves. Okay. So you feel it's the same neurostimulator we discussed, but we're just in a different area or section. That's followed by disruption by neurolytic agent or chemodenervation, And if you notice there, it's also divided by somatic nerves or sympathetic nerves. All right, so your chemodenervation. After that, you go to, you got repairs. You have your neuroplasty. And those codes, you got to just basically know the site where that neuroplasty is being performed. This section is followed by transection or avulsion. And again, you need to know location of the nerve in order to code in your transection or avulsion. You have your excision code, and it's divided by your somatic nerves or your sympathetic nerves. And you see the different excisions. You got a excision of a neuroma, basically like a tumor, excision of a neurofibroma. All right, you got sympathectomy, also found in this section. So it's pretty much what we expect. You got your neuropathy. That's another repair. And under the neuropathy, you see a lot of suturing of nerves in that neuropathy section. And then you have another neuropathy section that deals with your grafts. All right? And those codes are differentiated by the site and the length of the graft. And then the last section you have is the other procedure section, and it has only one code, your 64999, for unlisted procedures in your nervous system. This is going to conclude my presentation on the nervous system.